Good morning, everyone. I'm Kathleen Warshawsky with your Senior Care Spotlight. Today, we're going to meet with Miss Kristin. She is the owner of Nurse Next Door and the Director of Happier Aging, along with her colleague, Miss Michelle Duncan, and she is the Home Care Coordinator. Good morning, ladies.
Good morning. Thank you for having us, Kathleen.
Absolutely. So, Kristin, tell us a little bit about Nurse Next Door.
Well, at Nurse Next Door, we are a skilled home care agency. So we can provide services mostly for seniors, ranging from companionship through caregiving. We help with activities of daily living, light housekeeping, errands, transportation to doctors, and we are also able to provide skilled nursing services. So we have caregivers and nurses on staff to assist with our clients' needs. So they may be recovering from post-hospitalization, coming home from rehab. They could be working with other partners such as home health and hospice partners, and we partner with them to provide care for our clients.
Excellent. And I know you work very closely with home health and hospice. And so tell me how all of that works together.
Yeah, so those are some of our biggest referral partners that we work side by side with, and we really coordinate a plan of care for the clients. With home health, they're able to go in there for a certain amount of time, but sometimes their clients need extended care, and then that's where we come in, and we can help with the added activities that maybe home health is not able to provide for them for that extended period of time. So we can be in there from 4 hours to 24 hours, our clients, depending on their needs, and assisting with that. And then same thing with hospice. We have several hospice clients, so we stay in communication with their hospice nurses, keep in touch with how their progress is, what's going on. So again, we really work hand in hand and partner with them to provide care for the clients.
And I understand that you also partner with hospitals to help them to decrease their hospital readmissions. Tell us how that works.
Yes, absolutely. We work with the case managers, social workers, discharge planners, and as they are discharging patients home, we are able to, kind of help monitor them as they're getting back home, making sure that they're on the right track with their medications, that they're, feeling they have the support that they need, even getting from the bed to their wheelchair to have a shower, making sure they're not falling, which is one of the biggest risk factors, that, not taking their medications correctly or falling. And, so we can help keep them safe at home as they're recovering, and then stay in communication with their doctors as well.
Excellent, excellent. I'm sure that physicians also refer to you.
Yes, absolutely. Love working with physicians and keeping in touch with them.
And now during COVID here, a lot of people have changed some of their protocols. Tell us what's a little bit different for you all.
Well, we definitely had to stock up on more PPE, and we're that was challenging, I know, for a lot of people. But we have put in a screening in place for our caregivers every day. It's on our app that's on their phone, on our scheduling app, and it's a set of screening questions, and those are reports that Michelle and I approve each day. And then and if there were any yes answers to the questions, obviously if they had a fever or had been exposed to somebody, they would call us and let us know that right away. But we have that included on there. And then our caregivers and nurses, when they go visit the clients, they do the same screenings with the clients, just making sure if they've have any respiratory issues, fevers, have been exposed to anybody, or come in contact with somebody with COVID. So just staying on top of that. And, we really try and keep, continuity of care for our clients, so that we're not having a lot of different caregivers go into one client's home, and really limiting that to where,
consistency.
They have that consistent caregiver. Exactly.
Excellent, excellent. And so how do people pay for your services? Is it self-pay? Do you take insurance? How does all of that work?
It's a combination. We are private pay, and so people, pay for our services that way. But we do work with clients that have long-term care insurance. And so we'll help them with the paperwork as they're getting signed up. They need our tax ID number, a license number, all of that. And we'll send them emails with the invoice each week. along with the daily progress notes, because the long-term care insurance wants to know what's been going on each day, what type of services are you providing at each visit. So we provide all of that to the clients to submit to them. So they pay us directly, and then they submit their information to the long-term care insurance for their reimbursement. And it works out really well.
Excellent, excellent. So your title, or one of your titles, is Director of Happier Aging Culture.
Yes.
So tell us what happier aging culture entails.
Well, that is really the heart, and it's the culture of Nurse Next Door. And one of the main reasons that we were really wanting to be involved with Nurse Next Door is the happier aging culture that they have. And it's about really getting to know your clients. And yes, we can do all the activities of daily living and helping around the house, but getting to know them on a personal level and finding out what are those things that they love to do that they're no longer able to do. And then how can we bring that joy back into their lives? And it can be a variety of things. We have one client who years ago played Mississippi football at Mississippi State University. And I happened to be talking to this client one day, and we were talking about how Mike Leach is the new head coach, and he was excited. So we reached out to the program, and Mike Leach sent this client a text just thanking him for his support and helping him to build the program. And our client was just so excited to get this personalized text from someone that he admires so much and from a school that he's so proud of in their program. And it just meant a lot to him, and watching him share it with his friends and family. Another example is even doing something simple like finding out our clients if they have a favorite recipe that they used to love to make. And so one of our caregivers was with one of our clients and who lives with her son, and they said, "Oh, Mom used to always make this strawberry bread for us when we were younger, and she hasn't made it in years." And so our caregiver took the client to the store. They bought the ingredients. She helped her to make the strawberry bread, and the mom was just so excited to make it again. And then the kids were so excited to have it again, and it just was such a special impact. So there's lots of ways to go about it, and just really finding ways to, bring back those special memories and brighten their days.
Well, I love those examples that you gave of helping keep them connected to their memories and kind of some of the traditions that they might have as well.
Absolutely.
So that's
Yeah.
excellent. Now, I know that Nurse Next Door is a national company and you have coverage all over the place, but tell us about the Dallas coverage.
Yes. Nurse Next Door, we are a franchise, headquartered out of Vancouver, Canada, and there's over 150 locations throughout the United States. And we do have multiple territories here in the DFW area. So we have franchise partners that we're very close with, that we work hand in hand with throughout the area. And so if we get a call from one of our referral partners and it happens to be in our partner's territory, then we call them, we give them the information, connect them with referral partners so that we all, can work together. So we do have the full DFW area covered through 4 franchise partners. And like I said, we all work very closely together. It's a great family to be a part of.
Excellent. And if someone wants to reach you to learn more about Nurse Next Door, how do they contact you?
Yes. So they can contact me directly. And my number is 214-970-0203. And we also have our toll-free number that they can call, which is 1-833-611-2273. So again, that's 833-611-CARE.
Excellent. Do you have any final thoughts before we say goodbye?
Well, again, we appreciate working with you, and the Seniors Blue Book is such a great resource, and it's been great to find people that we can work with together through that. And we're just excited to have Nurse Next Door here in the DFW area and provide the home care, caregiving, and skilled care for clients that keep them safe at home. Again, sometimes it's working in facilities with them too, so we are able to do that and provide really, we enjoy providing that happier aging experience for our clients.
Thank you so much, ladies. I really appreciate it. That's Kristin Signs with Nurse Next Door and Michelle Duncan with Nurse Next Door as well. I'm Kathleen Warshawsky with Seniors Blue Book. This was your Senior Care Spotlight. Thank you.
Thank you.